Early detection and screening for lung cancer in Native Americans. Lung cancer is more likely to be cured when it's detected very early. At early stages, patients often don't have symptoms. Screening is a way to detect lung cancer at this early, curable stage. In a large study, screening found more than half of lung cancers before the patient had any symptoms. Compared with white Americans, Native Americans are less likely to be screened for lung cancer and more likely to not know about lung cancer screening, not have health insurance, and live far away from a screening facility. Native Americans may also be less likely to get screened for lung cancer because of mistrust of the medical system. Because of racism and past abuses, such as the forced sterilization of Native American women, Indigenous people often don't trust doctors. Traditionally, many Native American communities use tobacco in medicinal and spiritual ceremonies. It's considered a sacred gift of the earth and a symbol of peace and healing. However, the makers of commercial tobacco products have exploited the cultural importance of tobacco to Native Americans. As a result, Native Americans use tobacco more than any other racial or ethnic group in the United States. Smoking is the #1 risk factor for lung cancer. Lung cancer is a leading cause of death from cancer among Native Americans. Compared with white Americans, Native Americans are more likely to be diagnosed with lung cancer before age 60 and diagnosed with late-stage lung cancer. The bottom line is, for Native Americans at high risk for lung cancer, screening can save lives. And the best time to get screened is before you feel sick. You're eligible for lung cancer screening if you're between 50 and 80 years old and you currently smoke, or you quit less than 15 years ago, and you've smoked a pack a day for 20 years or 2 packs a day for at least 10 years, and you have no symptoms that could be caused by lung cancer. Symptoms that could be caused by lung cancer include a cough that doesn't go away, chest pain, shortness of breath, coughing up blood, feeling tired all the time, and losing weight without a known cause. If you're eligible for lung cancer screening, you'll get the most benefit if you have the test once a year. The test is done with a CT scanner and is quick and painless. You lie flat on a table while the scanner takes dozens of pictures. A computer then converts the pictures into detailed images of your lungs. You don't need to fast, get injections, or do any other preparation for the test. You will need to remove any metal you're wearing, such as jewelry or a watch. If you're feeling sick, you'll need to reschedule the test for when you feel better. Medicare and most private health insurance plans will pay for lung cancer screening. If you're on Medicaid, you'll need to ask whether your state covers it, as coverage varies state by state. Like any medical procedure, a low-dose CT lung cancer screening test has some risks. It involves a very small amount of radiation, about as much as everyone gets in 6 months from exposure to Earth's natural background radiation. If the scan finds something, you may need additional imaging tests to find out if it's cancer. In rare cases, the scan may find something that looks concerning outside of the lungs. If this happens, you may need additional tests. Don't hesitate to ask questions about screening for lung cancer. Here are some questions you might have. Why should I get screened when I don't feel sick or have symptoms? Where should I go for screening? How long will it take to get my results? Will someone explain the results to me in language I understand? And what are the next steps after I have the test? Talk to a trusted healthcare advisor today about screening for lung cancer. Ask if it's right for you and where you can go to get it. If you smoke, ask about getting help to quit. You'll get the most benefit from lung cancer screening if you also quit smoking.